Hello everyone, my name is Jamal Senga. The case study I decided to work on is the overcrowded clinics. In this particular scenario, the clinic that is in this study is very overcrowded. The patients get frustrated because most of them cannot get appointment when they want to be seen. This is a medical clinic that provides primary medical services to multi-ethnic community. Majority of their patients may not speak English. So the problems are, number one, scheduling appointment on time, where it may take 6 to 8 months to schedule an appointment with a physician. The challenge happens that most of these patients don't show up for the appointment. According to the study or the report, 20 to 40% patients do not show up for their appointment, so which leads to a problem. They have a large number of vacancies for that day, but issue is not the vacancy that they cannot fill. Issue is that these clinics are overcrowded because most of the patients just show up, and that puts strain on the medical staff, on the physicians, causes frustration in the medical staff. So the problem or the issue that needs to be addressed is that, number one, patients are unable to see their doctors when they're sick, and because the wait time to get an appointment might be 6 to 8 months, and when the day comes for the appointment, 20 to 40% don't show up, and that causes overworked staff frustration, and, uh, and the problem with this is because most of these patients are not able to get in and get an appointment for their desired time, is because the which leads to the patient just not showing up because 6 months later the patient's already well, or their condition became really bad that they had to go to the emergency room. So most of these patients are not showing because they either got better or they got worse and they don't need this medical appointment they made. And large number of patients, because they're unable to schedule or get an appointment uh, when they're sick, they just show up. So where 40% or 20 to 40% don't show up, another 50 to 60% may show up over the amount that's booked, which is what's causing the problem. Since this is a problem with the scheduling and a large number of patients showing up, or when during non-scheduled appointment or during non-business hours, a lot of patients are showing up right before lunch break or right before the clinic is ready to close and when everybody's getting ready to go home. This causes problem because it is challenge for the medical staff, because when doctors feel or the nurses feel overworked, they're they're rushing to finish treating these patients, can cause or lead to more medical errors, which can be detrimental to patients' health, or they can overlook at patients' conditions that need to be addressed at that time, or may overlook medicine that patient is taking before they prescribe the next one. So when large number of patients don't show up for their appointment, or they show up for their wrong date of appointment, I believe the reason for that is because the appointments are so far out that they're unable to, or they don't remember, or they don't get a reminder call. The report suggested that the reason they're not getting the regular day before reminder calls is because either their phone number is wrong, or just they don't have a phone number on file, so which causes a big problem. And since majority of the patients may not speak English, there might be a communication barrier between the staffing nurse and the patient. So the proposed treatment by this case study was clearing the backlog of scheduled appointment, and they suggested some sort of open system for a patient to have same day appointment, and where and additional suggestion was physicians can provide more services on the same day, that can lead to reduced number of follow-up visits, which will reduce the overall number of patients seeking treatment. Now, I have a problem with that approach because I don't really think that this approach really addresses the issue that we have at hand. When they're saying that they're going to clear the backlog of appointment, I'm not sure if they're talking about just canceling those appointments, or I don't know. Are they thinking about canceling the appointment where a patient doesn't even know if their appointment was canceled, or and they show up and then we still have the same problem. And if they don't have the patient's current phone number, how are they planning on reaching these patients and letting them know that their appointments are canceled? And this another suggestion was, or the same suggestion also said that they're going to have this open system where the patient can get the more desired appointment and the same day appointment. I'm having a hard time understanding how exactly are they planning to give them same day appointment. If currently the wait time is 6 to 8 months and they still have all these patients scheduled, and every day the clinic is overcrowded with the number of patients are being seen, how are they going to fit more patient into that same clinic, same number of physicians providing service, same nurses, same uh, medical setup? So I don't think that approach really would work, and if anything, it's going to cause more problem and frustration for the staff trying to implement this new system that at the end is just going to be just as frustrating as the problem that we started with. So my proposal would be a few changes they need to make for the clinic to run better. So clearly, they have a large number of patients that need treatment. These patients do need treatment, and they're not getting treatment on time. So how can we provide services to these patients that really need? Number one, if they have doctor to patient ratio is really offset, is too many patients per doctor. I think number one they need to look at is how can they accommodate that many patients. Number one, have more physician, add another physician to the staff, even if they don't want to have full time, do a couple days extra physician or half day, and have more nursing staff to accommodate the number of patients that are coming in. And so those two things need to happen for them to accommodate that uh, large of patient population. And next thing they need to do, hire or replace a current office manager. If office manager is not running the practice or the scheduling smoothly where the patients are waiting, that's going to cost clinic a lot of money, because they can have a medical error or malpractice lawsuits because things are not being taken care of the way they need to. So get rid of the office manager if they have one that's not working, or if they don't have one, bring one in, and have extended business hours. So if they can have extended business hours where these patients can be seen hour late every day after their work hours, or have open at least one day on the weekend where patients don't have to um, worry about losing their job to attend the appointment. They can come on these off days. I think that would really take the frustration on the patient's part and physicians, because now they have less number of patients, and that will lead to a reduced wait time for the patient. It's going to increase the number of patients can be seen at any given day, better job satisfaction among staff. Now, if the staff is not overworked, they're going to be more satisfied and provide better healthcare services for patients. And this will improve the patient health and overall patient satisfaction. And with increased number of patients, ultimately that would also increase the patient clinic revenue, which is a very important part in any business, and have a much better organized and efficient office. That's pretty much my take on that in a nutshell. I hope this helps. Thank you very much for listening.